Good. So I think then without any further introduction from me, I'm happy to turn it over to Klaus Zimmermann. Klaus, please.
Thank you very much, Michaela, as the editor-in-chief of this venture. I'm very excited to have you again from all around the world to join us to present a new issue of the Journal of Population Economics. As always, we are a bit early. I have to apologize for that. The issue in my hand. I still like to have physical paper, so to speak. I'm one of those oldies who, prefers to have the thing in the hand. But if you look at it, if you could look at it, yes, it says July 2021. So it's the July issue formally. And we are happy to be a little bit ahead of time with this product, but since we have so many excellent papers, as you will see. Now, it's my pleasure not only to thank Michaela already for guiding us routinely through the afternoon, at least here in Central Europe, but I have also to introduce and briefly welcome our other colleagues, the chairs, Madeleine Zawodny, who is like Michaela and myself, a migration researcher, professor at the University of North Florida. Then we have Oded Galler, who is the editor of this journal, but also the editor-in-chief of the famous Journal of Economic Growth, working on genetic diversity, long-term population issues, macro-demography, and is also the father of the unified growth theory. And last but not least, my great pleasure today is to welcome as a new editor, just in the last second, so to speak, he came in to help us further with the flood of manuscripts we face, Alfonso Flores Lagunes, who is at Syracuse University and at the School of Citizenship and Public Affairs. And he's a very well-known econometrician and public program evaluator, works on education and health and so on. And he will hopefully help us on health and education issues, which are coming in a lot and with applied papers. Now, well, I also, of course, have to thank the institution behind me. Yes, that's UNO Merit, the entry building in Maastricht. So I'm sitting here on the street looking at you. No, not true. We can pretend to be anywhere nowadays. Yes, so but it's a very nice think tank. It's a kind of daughter of Maastricht University and United Nations University. So it's another part of our life, and they host the journal and support also this event together with Maastricht University. Now, how do we choose the papers from the issue for this session? Well, 10 might be a little bit too many. Yes, we have always 10 papers in a session in an issue, so it's more difficult to make a selection because all of these papers are excellent. I can guarantee that. We worked hard on it together with the authors. The authors worked hard, and we also, but the authors more than we. And we have to make a selection, and that typically is a lead article, and then some papers fitting together well, and where the authors are available. And this time again, as last time, also in the last times, some of the colleagues just couldn't make it at this particular time. So those who are not presenting here are not the not so good papers. Yes, that would be a misinterpretation of the situation. Now, but we show variety here. We also would like to show focus, because it's clear the better we are focusing on some topics, the more papers are cited and discussed, and this is also part of the reason why we do this. Yes, of course, we hope that through these presentations we get involved with the researchers and can do more PR with it and attract better papers in the future, many good papers than we in the average get. As you know, we get a lot of papers. We have about 1,000 at the moment, about 1,000 manuscripts per year, which go over our desks. And at the end, well, we can only accept about below 5% of submissions. So we have to somehow do what all major journals are doing. We have 2 rounds of desk rejections as a first screening, maybe where we lose about 50%, unfortunately, of often very, very good manuscripts. And then in the second stage, when it is the responsible field editor, we again have maybe desk rejections, and then it goes to referees, and that will take time. However, we felt that during the pandemic, people said, well, you get more papers, that's true, but also you get a slower process. We cannot really observe that. I think the colleagues, including yourself here, but many out there are very helpful in writing referee reports. It's not that we don't get enough referee reports. You can never get enough good referee reports, of course, but we get them, and we can also be quite fast in some processes. Not, of course, COVID-19 papers have a special speed at the moment. We cannot hold that for the whole process, but we try to be fast if it's a paper which is timely. Yes, that's certainly hopefully understood by everybody. Okay, now I see 2 minutes or so to talk to be in time. I mean, I should maybe explain something else for those who are listening and want to learn why we do this and that. Yes, I mean, we certainly like full papers. Yes, short papers are not a good. They're not a good address for short papers. There are other journals preferring that. We like full and round papers dealing a topic very solidly. And that's why we're also not anxious about space as long as it's justified. Yes, of course, hundreds of manuscripts, hundreds of pages is impossible, but a nice long paper, I mean, it can be 20 papers, it can be 50 papers, 50 pages. So in a way, that size doesn't matter as long as its quality is justified by it. However, the other problem we have and often face with submissions is that people think they can add hundreds of pages of online appendices which nobody reads, and we in principle have to judge. We dislike that. So while you can submit this material, please don't expect that we publish this. And we also don't publish it online. We offer people to find other sources to make it available, like discussion papers, and that's done in the process. So just for a bit of understanding and communication. Now, I welcome all of you who want to submit innovative and exciting material. Please go ahead, do this. Even don't be afraid about the desk rejection policy. In the worst case, you can submit your good paper somewhere else and get it published. So choose us if you have a good, promising paper. Now you see today lots of good, promising papers. That's why we have published them, and we hope that they will have an effect on the profession. And well, I now hand over to a person who I don't need to further introduce, Oded Gala, who will guide us through the first session. Oded, please go ahead.
Thank you very much. Good morning to all of you. So the first session will include 2 papers. The first paper, I will allocate to it 20 minutes for the presentation itself and about 10 minutes for discussion. If you have questions, please, you can post them in the chat. But otherwise, if you are plugged directly into the network, you can simply raise your hand and we will allow you to ask these questions in the end of the 20 minutes. Okay, so the first paper that we will have will be presented by Michael Poiker from the University of Nottingham. And this will be about pandemic response in the era of Fox News, focusing on the safest time to fly. Please, the floor is yours.
Thank you. Let me share the screen. Okay, can you see the screen now? Yeah, good. Okay, thank you so much. Thank you for accepting the paper. Paper benefited a lot after 4 referee reports and like 30 pages of responses. This is a joint work with Maxime Nani from University of Melbourne and UNTN from University of Nottingham. And we indeed will discuss the effect of slant media on public health behavior, a pandemic response in the era of Fox News. Why do we care? We know that media plays a very important role in people's life, mostly through the transmission of the information and shaping belief. And there are many papers that study these issues. We know that media affect trust in government, in science, perception of threat, and this may be all important in the context of public health. And in such case of a COVID-19 pandemic, in any case of such pandemic, such fast reaction on what science like CDC tells you to do is very important. And whether people comply with these policies, we care about this, and we care that the media may shape this behavior in a good or bad way. And thus, in this paper, we studied the case of United States. And in the United States, up to 2020, Fox News channel was the lead, the major, most popular cable news channel. And because it was so most watched, it also could affect people's behavior. And it for sure has a well-documented conservative bias. It was documented that Fox News channel affected votes for Trump, for example, for Republicans. Thus, it may have also effect on compliance with public health behavior. And on March 13, 2 days after the WHO declared the pandemic, one of the most watched Fox and Friends show of the Fox News said that this is the safest time to fly because the terminals are dead. There's something entirely opposite from what the World Health Organization and already CDC started to tell people. To let you see how the initial attitude of Fox News toward the COVID was. This was one of the screenshots of their TV show. How would you grade President Trump's leadership in the nation's fight against the WUHAN virus? Superb, great, and very good. And people would need to tweet this. Clearly, it's not serious, and there is something about the message that they want to say with the Wuhan and how Trump is good. But nothing about that people need to behave carefully to save lives. Thus, what we do in this paper? In this paper, we study the causal impact of slanted news media on public behavior during the COVID-19 crisis. And we ask 2 questions. First question, did exposure to Fox News lead to a smaller reduction in distance traveled and smaller increase in the probability to stay home after the national emergency declaration in the United States? This is the big question. And second question is, what are the mechanisms of that effect? Okay. Summary of this paper, what we do here. The institutional context here is the earlier spread of COVID-19 in the United States when it was just announced that it is dangerous and important, and introduction of national emergency in the United States. The data that we are going to use will come from 3 sources. We will have a county level internet-based location data from 15 to 17 million smartphones for whole United States. The source of the data is Unicast. We will also use zip code level internet-based location data from 4.2 million devices from 14 states that come from Facebook. And this is for our Y outcome. And for our X, we will use zip code level on Fox News channel lineup position that comes from Nielsen. Using this data, we will estimate the effect of Fox News channel exposure on changes in physical distances. And then we will measure basically the heterogeneous effect of built up Fox News channel exposure on people's behavioral choices. Our identification will be exogeneity of the historical position of Fox News channel in the cable lineup. That's basically Fox News channel, when it was introduced into every location, it introduced exogenously for the position that was open at the time. Yeah. Okay, this is the summary of the paper. Preview of the results. What we find is that before the national emergency, the mobility was similar in areas with different Fox News channel positions. But basically, before national emergency was introduced, people moved the same way everywhere. But after national emergency was announced, a 1 standard deviation increase in exposure to Fox News channel led to 0.5 percentage point larger decline in county level average of distance traveled relative to the pre-COVID period, and 0.1 percentage point larger decline in the probability of staying at home. And if to understand the relative effect, comparing the effect size with the state level reduction in mobility, this effect can explain 2 to 8% of the total reduction of population movement. As in some states, it can explain 8%, in some states 2% of the total reduction in mobility. It's quite a lot in some states. Okay. What contributions do we do with this paper? First, there is a quite big set of literature on the impact of media that studies the effect on voting outcomes. For example, Delavinia Kaplan, Petrova, Zhuravskaya, Nikolopov, effect on conflict, Yanagaziva-Drot, and so on. Here we show how biased media can have public health consequences as well. This is usually a non-political outcome through change in people's behavior. Then we also demonstrate that in addition to shaping people's mindset in the long run, information can shape people's behavior in the short run, and especially, and this might be very important when collective action is needed in the times of public health crisis. We also contribute to the literature that use very granular real-time individual level data to study people's behavior. It's a very growing set of literature, and researchers started to use cell phone data to study economic activities like segregation, networks, social networks. And here, in addition to documenting changes in mobility before and after the declaration of national emergency was announced, we investigate the potential determinants of such geographical variation and highlight the importance of media here. And finally, we contribute to the growing as a snowball literature on COVID-19 pandemic, especially related to the determinants of physical distancing and transmission. Here we show that the policy change at the federal government level, for example, national emergency declaration in the United States, combined with media consumption, had a large impact on people's mobility reduction. We also causally can identify the effect of media on social distancing practices. And here we emphasize that not only the pre-existing political views, but also the flow of information through slanted media can shape people's view. It's important to know that there are 2 other contemporaneous papers that also study the effect of Fox News exposure on public health behavior, Ash et al. And Simonov et al. But we are better because we are more exogenous. Please read the paper for more details. Okay. The rest of the paper, I will discuss some background about COVID in the United States and Fox News channel. Then I will introduce the data, all sources of data variation, and show briefly our empirical specification. But I will show no tables because it's a summary paper, a summary presentation. Okay, background. National emergency was introduced in March 13, as far as I remember. I just moved from New York to Pittsburgh on March 11, just before it all started. And after that, states started to introduce their own state-level stay-at-home orders. And as we can see, almost all states that ever imposed stay-at-home orders almost immediately imposed them immediately after the declaration of the national emergency. At that time, CDC, while initially it say, no, we don't need to wear mask, but then they changed their opinion, and with the national emergency, they also told people to stay home and wear masks. So, but at the same time, Fox News had a very different message on COVID-19. When CDC was saying, and Dr. Fauci was saying that the measure deemed necessary to limit the spread of COVID-19 and physical distancing, there were 3 distinct messages of Fox News channel that we came up after reading thoroughly and laughing a lot on the transcripts of the Fox News. First, they downplayed the potential dangers of the virus and suggesting untested medical procedures. Like President Trump also suggested to drink bleach, if you heard this thing. Then they also alleged that Democrats are using the pandemic to undermine President Trump before the election. And finally, they were emphasizing on potential culpability of China and Chinese government in the pandemic. And the issue is that these messages could potentially affect people's evaluation of the risk and their willingness to self-isolate during the crisis. At least because people have limited attention span. And if you fill their heads with the fact that Democrats are bad and China is bad, there is less attention to remember that they need to keep some social distancing. Thus, what are those messages about the COVID? That COVID is just a flu, and they had such. Like this is also a screenshot from from Hannity show, where they were screaming that COVID is not important because no one died in the United States. Another type of the messages, as I said, Democrats' partisan interests. They were screaming a lot that it's a coronavirus impeachment scam. But most important, as we found out after analyzing the transcripts of the Fox News, is that most time that they were speaking about China and nothing else. For example, here we compare the word clouds of COVID-19 coverage for Fox News in the left and MSNBC on the right. And we can see that MSNBC emphasized health risks, outbreak, like such health-related things. On the left side, in the Fox News, we only see Chinese as the most popular words. Thus, talking about China, calling it WUHAN virus, instead of talking about safety, in our understanding, is the message that could affect people's compliance with the safety measures. Okay, now let's talk about the data that we're going to use. Exogenous variation in Fox News exposure. Fox News viewership is clearly correlated with the political preferences, because people watch more Fox News in area where they're like more conservative. And this can potentially bias our estimate if we use Fox News channel viewership and social distance. However, there is a known instrument from Martin Yurukoglu paper 2017 in IR, where they use the exogenous variation in channel position of Fox News channel in a lineup of the remote control. Basically, if people are, if you have Fox News channel on number 20, you are more likely to watch it if you're indifferent than if it is on a number 40 when you're just browsing your channels on your TV. That's this, and they found out that this geographical variation in channel lineup of Fox News that started in 1998 and just would randomly add in every location on a position that was available is uncorrelated to the conservatism and conservatism predicted by the demographics. And we actually do the same. We showed it on our subsample. It also through the 2005 Fox News channel position, historical one, is uncorrelated to the conservatism, predicted conservatism, and pre-treatment social distancing. Here we use the zip code level average historical 2005 position from Nielsen. We will aggregate it by population weights for the county level regressions, and we will use the zip code level for the zip code level regressions. Fox News channel position varies from number 1 to number 95, and the standard deviation is about 15 channels. And yeah, as I said, it is not predicted by pre-treatment Republican voting share. Good. How does it look? It looks something like this. You see, there is a lot of variation. Some areas, even those in Midwest, the Trust Belt is quite dark. That in there, even if they are voting mostly for Republicans, you can see the channel position there sometimes is very high. And in some locations, it is very close to the top of the channel. Now let's talk about our outcome variable, our Y. And here we use smartphone data on people's mobility. Our county level data comes from Unicast, and they have 15 to 17 million identifiers for each day in a data set from February 24th to April 14th. The key thing about this data is that it is already adjusted for the pre-COVID mobility. That it is already adjusted to the baseline mobility. And we also have a zip code level mobility measures that we constructed using data from Facebook. And this thing is for 4.2 million devices per day, and they cover 327 counties from 14 states. And here we can measure not just the differences in distance travel, but we can measure the probability of staying in the same tile, which we call staying at home. And we also can measure total distance travel. And we adjust both measures for pre-COVID period. This is how the county level data for Unicast looks like. We see that some areas had more decrease in daily distance travel than other, and there is a lot of variation. You can't say that there is something weird with this data. What is most important here is that we use two different sources of data, and the thing is that both sources of data are not representative, because Facebook data, the people who use Facebook are more younger, for example. And Unicast data is also not representative because we don't know what exactly applications are used when they collect this data. There is another source of data, safe graphs, that many people use, but most of the papers on the market here use only one source of the data. And I think it is important to use two because we don't know about the representation of this data. But here we actually can show that both of our data sets, when we measure them on the same level of aggregation here on a county level, yield similar results. For example, here we show that distance traveled using Facebook data is highly correlated with the difference in daily distance traveled from Unicast data. And similarly, we can show that the difference in daily distance traveled in Unicast correlated to the probability of staying at home. Thus, despite the fact that this data comes from different sources with different bias for representation, they are yielding similar results. And this is a very strong side of our work. Okay, thus, when after showing the data, I will show you our baseline specification. And in our baseline specification, on our left-hand side is a measure of social distancing in a county I located in a state S and on date T. For example, this will be distances and distance travel from Unicast. And on the right-hand side, in the most baseline specification, we have our Fox News channel position in 2005 that is county nested within a state, interacted with before the national emergency dummy. And there will be Fox News channel position interacted with after dummy. As basically, we are estimating heterogeneous effects of Fox News channel exposure. And it's important to note that this is not difference in difference because all the counties are affected. Some are affected more than another. We will have also specification that will have like county fixed effect, and this first term will be absorbed, but it's nice to show that there is no pre-trend kind of. And instead of showing the results, the real results, I will show you the raw data results. This is what we are basically doing with that regression. Here we plot bottom 10% percentile of Fox News channel exposure counties and top 10% percentile Fox News channel exposure counties. And we can see that before the national emergency was introduced, both group of county have different, the same distance traveled changes. But after national emergency was introduced, counties that have lower exposure to Fox News channel decrease their distance more than those that have higher. And we, with our specification, we basically measure the average decrease difference between these two lines. Yes. Okay. The mechanisms. What can we say about the mechanisms?
We have at most 1 more minute, so please.
And I have only 2 slides. Yeah. Here, the effect of Fox News channel exposure can be explained by 3 channels. It can be built-up conservatism, because for the last 15 years, people were watching Fox News more, and now they are reacting less on advices, health advices. Second, it can be a COVID-19 related information transmission, and then it can be interaction of both. Here we can show that we can control for the contemporaneous levels of conservatism, and thus we can say that the effect is not driven by built-up conservatism. Thus the effect is driven by the COVID-19 related information that Fox News transmitted, maybe with interaction of on the top of the built-up conservatism. And the future research may tell distinguish these things. Okay. Basically, that's all. Here we estimate the effect of exposure to one of the most popular media source, Fox News channel, that spread controversial partisans' opinion and some unscientific medical advices during the early days of COVID-19 pandemic on mobility reduction and social distancing. Here we show that increased exposure to Fox News channel led to a smaller reduction of distance travel and smaller increase in probability staying at home after national emergency was introduced. And the results are not driven by conservatives itself, but instead driven by media message and potential interaction of the built-up conservative ideology and the message. Thank you.
Okay, thank you very much, and very interesting. So we have 6 minutes left for questions. If you have a question, please go ahead and ask it. Klaus, please.
Well, maybe I should not ask a question because I was the editor of the manuscript. But normally, I mean, since I was in political activities and advisory activities, and often involved with media, so my experience with media is that typically they like to scandalize things which produce trouble. Yes, so troublemaking is good. Yes, in a way for media. Now this is the opposite of making trouble. This is about calming down. Why could this happen? Or what do you think about this asymmetry?
I think that this was due to the upcoming election in the United States, because they wanted to show the strength of their leader, because the Fox News channel was supporting Trump a lot, and that's why they wanted to hush the opposition, and Democrats who were opposition at the time were screaming that for the safety measures and the government is acting incorrectly, and that's why they made a stand for Trump, and that was my understanding. I think most of the things that Fox News channel is doing is just byproduct of their support for Republicans. For example, I have other paper on with Elliot Ash on effect of Fox News channel on sentencing decisions, and there they are frightening people with drug and black crimes, toughness on crime, and then it changed people's opinion about crime, and then in areas where judges are elected, judges have to cater to those changing opinion and start to become more tough on crime. That's here it had the same situation. They were trying to say that the Democrats, this is not this, there is no problem. It's just some problem in China, but not here in the United States. And as a byproduct, more people got COVID, more people died, and then as in another paper that you accepted, it affected the votes against Trump. That had the opposite result. But I think they just were trying to help Republicans.
So if I may, so naturally, you discussed quite lengthily the fact that the sort of the obvious confounder is the fact that the presence of Fox is predominantly in red states. Now, did you try to conduct your exercise based only on variations within red states, only within predominantly Republican states, to see whether in fact greater exposure within red states is making a difference? But this will be an obvious way of disentangling the red state effect and the Fox effect. And I should mention one more thing. During the pandemic, Trump was conducting nearly a daily press conference in the evening that was broadcast naturally by Fox, but by the rest of the networks too. So how do we separate the propaganda of Trump himself from the one conducted by Trump, by CNN, by Fox News?
Okay, I answer second first. Second question, because everyone is, because these press conferences are shown in all channels, that's why it's our treatment is not just the conference of the Trump, but everything else that is translated at the time in Fox News. Okay, so basically, it's everyone is getting treatment by the Trump's press conference.
Right. So first, you conduct analysis only in red states.
Okay, about this thing. Here, what we did, we show that our Fox News channel position in 2005 is uncorrelated on a county level, on a zip code level, to the pre-Fox News channel vote share for the Republicans. Thus, our treatment, our Fox News channel lineup is uncorrelated to red state or democratic states. And that's why here we don't have a confounding factor that you're talking about. That's why we are using this Fox News channel position, because it is uncorrelated to the conservatism. We did
another question from the audience, since time is short.
Yeah.
And the question was, if I may rephrase it, is whether you conducted some placebo effects, trying, for instance, any other channel and showing whether, in fact, trying another channel will not have an effect.
Yes, yes, we did CNN and MSNBC, and we showed that they do not have this effect as a Fox News channel. And we did add some heterogeneous effects with Republican vote share in revision, but they are not conclusive because for, current conservatism is already affected also by the Fox News channel position in 2005. That's why, and to split states into the red states and democratic states, it would be already arbitrary. But we do not expect differential effect because we don't see our Fox News channel position is uncorrelated to the pretreatment.
Very well. Thank you very much. It was
thank you.
Fascinating. Thank you very much. So let's move to the next paper. The next paper will be presented by Masha Pedersen, and this is about Malthus in pre-industrial northern Italy. Please, the floor is yours.
Okay, thank you very much. And thank you also very much for the possibility of being here today.
Can you activate the camera, please?
No, I'm sorry, because it's not working. I'm sorry.
No.
Technological problems.
Okay.
But I hope you can see my slides anyway.
Well, it fits the pre-industrial period, so that's
okay,
fine.
Perfect. Okay, so what I will be talking about today is Malthus in pre-industrial northern Italy. And it's a joint work with Paul Sharp and Claudia Riani. So why is this interesting? It's interesting because unified growth theory, which assumes that all economies before 1800 were in a Malthusian period, followed by a post-Malthusian period, before they were able to enter a regime of modern growth. So this is what unified growth theory believes, and we want to test this empirically, as has already been done for other countries, beginning with England. The first studies tried to understand if England was Malthusian before the Industrial Revolution. And in later years, we have also seen other studies, so studies regarding France and Italy and Scandinavian countries as well. And the fact is that Italy is a very interesting case because, as De Rosas notes, the rules of family formation in Italy would include other solutions than the establishment of a new household by the newly married couple. So Italy might exhibit some very different patterns with respect to, for example, England, meaning that maybe the income restraint is not as strong as it would be in England. So this is why Italy is a very interesting case when you test the Malthusian model, because maybe we might find a weak preventive check or no preventive check at all. So what we do is that we have data from northern Italy covering a period from 1650 to 1881. We choose to stop our analysis, our main analysis in 1799, because we want to avoid any effects of the Industrial Revolution, so of the modern economic growth. So this is why we believe that it's better to stop a little earlier to be sure that what we are studying is a pure Malthusian period. And we do this using a co-integrating VAR model, which was first proposed by Müller and Sharp, where they used this model on English data. So our work relates very closely to their work because we follow their model very closely, but we take up the case of Italy instead. And when it comes to Italy, there are two other studies trying to test Malthusian mechanisms in Italy. The first is Fernihow from 2013, who uses the same data as we do, but he covers the entire period, and he also uses other models. And we believe that the co-integrated VAR model is a better model, first of all, because we are able to concentrate on the long run equilibrium dynamics instead of the short run. And furthermore, because of the non-stationarity of the variables included in the model, it might be better to use the co-integrated model instead, because this is specifically for data which is non-stationary. But anyway, anyhow, he finds that Italy should be Malthusian until 1881, because he finds evidence both from a positive and a preventive check, and also that there are diminishing returns to labor, which are the three essential parts of the Malthusian model. The other study instead is not able to test directly the Malthusian model, because Chiarini uses long data series only on wages and population. So he cannot test unified growth theory directly, but he still can test the mechanisms going from wages to population and the other way around. And he finds actually that an increase in wages would cause a decrease in population, which might be very puzzling. So this is another reason why we believe that it's interesting to test directly the Malthusian model using the right data also. And actually what we find is that we find this negative relationship also between wages and marriage rates. So very similar to what Chiarini finds in this sense. And we find a weak positive check, and as anyhow, we also find the presence of diminishing returns to labor. So we can say that it's likely that Italy was quite Malthusian, but also different in some way, because we find this negative relationship between the marriage rates and the wages. So this is our main findings in this paper. So just a brief presentation of the relationships of the Malthusian model, because they are so essential when we have to test it, of course. So they are the preventive check, in which we have two phases. So we have, in this case, income, which influences the marriage rates. So an increase in income would increase the number of marriages. And of course, the number of marriages then would increase the number of births. Then we have the positive check, where we see an increase in income, which causes a decrease in mortality. And then finally, the essential part of the Malthusian phase with respect to the post-Malthusian is that we have diminishing returns to labor, in which a larger population would imply that the per capita income will decrease. So this is the difference between the Malthusian and the post-Malthusian period, is this fact that we, in the post-Malthusian period, no longer will find the diminishing returns to labor. And in this system, when we resolve it, then in equilibrium, we'll have a constant subsistence level of income and a constant population size. So these are the essential parts of the Malthusian model, as will be presented in the paper. All of this can be written with equations, as they did in Müller and Sharp. So they create this Malthusian model where they can solve for equilibrium in the four variables, birth, death, and marriage rates, and then real wages. And we will do exactly the same thing as they did, because we have the same four variables. The three vital rates are from Galloway, and the real wages are from Malanima. Our wages differs from the English, for example, because we use an average of urban and rural wages, which is different from the English, where they use only the urban. But in the case of Italy, they have a story of urbanization, which is quite different, and that makes it better to use the average instead, because otherwise we would risk to obtain biased estimates if we use only the rural or only the urban wages. So therefore, it's better to use this average. When you solve the model, you will obtain a matrix that includes all the estimates of interest. This matrix is essential for our econometric framework because if the matrix has full rank, it means that we are in a pure Malthusian regime. If instead we find reduced rank, which is the case, then it means that there's something in the model which is not explained by the model. So in the data that is not explained by the model. And theoretically, this would give two different hypotheses. So Müller and Schaap, they present two different hypotheses able to explain why we find reduced rank. And the first is that the sum of the positive and the preventive check is 0. So those two, they become 0. And the second is that they can test directly the Malthusian regime so that diminishing returns to labor are no longer present. And in this case, we have this matrix which can be decomposed into two other matrices, so alpha and beta, which are the alpha will contain adjustment parameters in the co-integration approach, and the beta matrix will contain our main equations, so the three relationships, the positive preventive check and the diminishing returns to labor. And on these two matrices, we can impose the restrictions which correspond to the two hypotheses to test whether one of the two can be the case in Italy, because we find this reduced rank. Of course, I have to mention that before we can continue, we have to assure that our data is non-stationary, so that all of our variables are non-stationary, because otherwise it would make no sense to follow this co-integration approach. And we find indeed that especially for our smaller sample, this is the case. And of course, we also test for the lag length and the errors to assure that our model is well specified when we start to estimate. And what we find is that we cannot accept any of the two hypotheses that were proposed by the theory. And we find, because we cannot accept the restrictions, and then we find that the positive check is not significant in any of the two. And then we find this negative relationship between marriage rates and wages, which is a little puzzling. So what we can do is that we can relax some of the restrictions on alpha and beta to see why we cannot accept. And what we find is that when we relax the assumption that wages are weakly exogenous, then we can accept these new restrictions that we impose. And that means that that's a clear sign that Italy was more Malthusian, because we find evidence for diminishing returns to labor. So this is what we can conclude when we relax the restrictions. So it means that we cannot use any of the two theoretical hypotheses, but if we relax some of the assumptions, then we find that wages are endogenous to the model, and we can accept. And just briefly to show you the estimates, so you can see the first two columns are the homeostasis hypothesis, where birth and death rates they are 0, and then the second is the post-Malthusian hypothesis. And the p-value for the over-identifying restrictions is very low, meaning that we cannot accept. Whereas in the third column, you can see that we can accept with a high p-value of 50%. And we have called this the Chiarini's hypothesis because the result is very similar to what Chiarini finds, so that there is this negative relationship between population and wages, and also the fact that that wages are endogenous to the model. So in this case, we can accept, and we find still this negative preventive check, which is very significant also. So the explanations for why we find this reverse preventive check, so this unexpected sign, can be also found in Chiarini, for example, who explains this with what he calls an old age security motive, in which parents can see children as a capital good. So children will be able to move capital from young to old age of the parents, so they can decide whether to invest in children or in other goods which can do the same. And they will only invest in children if these yield a higher benefit. So of course, in some cases, it's possible that parents will choose to invest in, for example, better crops or new technologies instead of having children. And furthermore, Italy presents a very peculiar urbanization pattern with respect to other European countries, because she urbanized quite early on, but then she started to de-urbanize when all other countries started their own urbanization period. So we also have some different mechanisms between city and rural areas, which might influence the fertility choices. And again, we have also the fact that in Italy, there were many years with changes in temperature that affected very negatively the agricultural output, meaning that Italy was in a very risky disease environment, meaning that people might decide to postpone their fertility choices to later on when the risk of dying was less. So parents might choose to postpone even if income increased because of the high mortality rates. And the final explanation can be this collectivistic marriage pattern, which is more or less what De Rosa stated, and as I presented in the first slide. We're saying that the newly married couple would not start their own household, but stay with their parents. So the income restraint would be less strong, less important in this sense. And when Malthus elaborated on his own theory in his famous essay, he was thinking about the individualistic marriage pattern instead, so where the newly married couple would create their own household. So this is also an explanation to why Italy might be different, because they were more in this collectivistic pattern instead. So what we can conclude is that Italy was Malthusian in the sense that there was a pressure on income every time population increased, but that we find this different pattern in marriage, wages, because we find a negative relationship instead of a positive relationship. So this makes our results different from England or from other countries like Scandinavian countries, for example, where they find that the preventive check is, as expected, positive. So we have a positive relationship between the two.
Okay. So thank you very much. I mean, this was very interesting. I think the quality of the sound is such that perhaps we should cut the discussion. In any case, we're violating the time constraints. So I think that people are encouraged to send directly comments and questions, and I hope that Maja can respond to it in other channels. But I think we should move forward, and I'm transferring the torch to others.
Okay.
Perfect. Thank you very much, colleagues, and thank you, Odit, for getting us started in the first session. If we could please hand over actually to Alfonso Flores Lagunas, our newest editor. Thank you very much for joining us.
Thank you very much. I am happy to be here and happy to introduce the following two papers. The first paper is by Thomas Hofmacher. I hope I am pronouncing your last name correctly. And he's going to talk to us about the effect of paid vacation on health, evidence from Sweden. You have 10 minutes, Thomas.
Yes, thank you for this. Let me just share my screen quickly with you. I hope you can hear me well and see the screen now. All right, thank you. So let me start by thanking the editors for accepting this paper. I'm really happy and proud to see it in the July issue. And so this paper is about vacation and its effect on health. And I should say also what I mean by vacation here. So vacation here means annual leave. So it's the time that employers grant or have to grant to their employees every year to have some time off from work. And the motivation for this paper is really that as an aftermath to the Great Recession, 2009 and later on, many countries around the world have started to cut what they have been perceived as being generous vacation entitlements. So some examples are Finland, Ireland, even Saudi Arabia, and Switzerland. Actually, they went the other way around. They had a referendum in 2012 on whether to extend their mandatory vacation from 4 to 6 weeks. And the surprising thing is that the population in Switzerland, the Swiss people, voted against it. So they said, we don't want to have 6 weeks of vacation. 4 is totally enough for us. Let's not destroy the economy. That was their main argument. And also then the argument in the other countries why we should cut generous vacation entitlements. Very little focus on workers' health, and that's surprising. And it's surprising because it contradicts the historical argument with which vacation was really introduced 80 to 90 years ago in Europe. Sweden was one of the first countries in the world to introduce paid vacation back in 1938, and Sweden introduced 2 weeks back then. It was further extended to now it's at least 5 weeks for every employee. And it's a similar development in most other countries around the world, not least in Europe. And since 1983, all member states of the European Union, for instance, have to have 4 weeks of paid vacation. So every employee has to have 4 weeks of paid vacation. And the very purpose of this working time directive, as it's called, is to protect workers' health and safety. So again, a pervasive emphasis on health. But that was not considered lately. So that got me thinking really about this topic. What's the effect? What do we even know about the effect of vacation and health? And let me start just by sharing my theoretical thinking on this. As a health economist, I mean, thinking of Michael Grossman's health production function, there are really just 2 channels for which health can be produced in this setting. One is through leisure time. So giving workers more vacation means that they have to work fewer hours. And generally it's believed that more leisure time is beneficial for health. So more vacation should make you healthier. And then there's an income channel also. If more vacation, for instance, comes along with an additional vacation pay, several countries have this in place, then you might be able to buy more health through your increase in income. That's not the case in my paper in Sweden. You don't get more money as you get more time off. Yeah, your income stays the same. It's really just leisure time that changes. And that's similar to other papers that have looked at sort of the broader topic of working time and its effects on health. So there's a paper on overtime, for instance, from Denmark that finds positive relationship. Same for weekly working time, where it's really just the working time that changes, but not income. They also find a significant relationship of working less means better health. And there's nothing on vacation, really, nothing that I can find. So I was really happy to have this idea and to find an empirical setup that I will talk to you about in the next slide. There's also some other literature that I should note, not by economists, it's by psychologists that do find an effect of vacation, but actually of really going on a vacation. They call this also a vacation cycle. It's interesting literature. It's not causal. Same goes for physicians that also used longitudinal cohort studies and also generally find that vacation has a positive relationship with health. but again, it's not causal. So I'm really happy to be the first one to contribute to this literature through a causal study. And the empirical setup for the study is the following. Well, the main issue is, of course, to try to overcome self-selection, because workers can self-select into sectors or jobs that grant them different numbers of vacation days in countries where it's possible. In other countries, you just have a fixed number of vacation days, and then me as an economist, I have zero variation to work with. So then I cannot study this issue. In Sweden, there is a setting where we can exploit a natural experiment, and that's in the central government sector, where there's an age-based rule for vacation entitlement. Try to illustrate that on the right-hand side. So if you're younger than 30 years, you have 28 days of vacation. The year you turn 30, you get an increase by 3 days to 31. And the year you turn 40, you get an additional increase by 4 days to 35 days. 35 days, that's working days, so that's 7 weeks of vacation per year. And the good thing here is that the full vacation entitlement is always received on 1st of January every year, which really gives rise to 2 discontinuities, one at age 30, one at age 40. And I'm exploiting both of these discontinuities. So the implication here really, so for you to understand the setting where we can have a control group and a treatment group, is that someone that's born late in the year, like me, December 31st in a certain calendar year, might get 3 additional vacation days, whereas someone that's just a tiny bit younger misses out on those days in the year where the former turns 30 years of age. And the way to exploit this empirically is to use regression continuity design. There's an additional complication in the Swedish setting, which necessitated also to combine this regression discontinuity design with a differences approach. So what I really do is I estimate the effect at the actual thresholds, comparing people that are 30 years old to the ones that are 29 years old. But then I'm also estimating the same thing for people that are 28 years old and 27 years old. Between those that are 27, 28, there should be nothing should change. So I'm sort of deducting their difference in health from the one that is observed at the actual threshold. That gives me my causal estimate, and that really tries or it really aims to remove those any factors that are time invariant between consecutive cohorts. So sort of making sure that the covariates are balanced. Let me talk a little bit about the data that I'm using here. So I'm using registry data, as you probably guessed when you see a study from Sweden on the entire population. That's what I had access to. But then I'm only focusing on the central government sector, which covers 5 to 6% of all employees. So that translates into around 220,000 people or individuals. And I'm pooling actually all those people that I observed between the period from 1997 to 2011. Health is my main outcome, and I have 3 different measures to quantify health. One is visits to specialist outpatient care. So these are all visits to outpatient care except visits to your family doctor or your like a GP. Admissions to inpatient care, so to hospital, that's another measure. And the third one is long-term sick leaves. And the main results of this paper is that getting an increase of 3 or 4 vacation days at age 30 or 40 actually has small and statistically indistinguishable effects. So there's no effect from getting more vacation on health. And then whenever you try to publish a zero result, the question is, how reliable are those results? Can we be confident about them? So I did a lot of work on really trying to increase the confidence in these estimates, try to do a single indicator for experiencing any of the 3 health outcomes, also created an index to increase the variation that I'm working with, and I also try to bunch together observations at age 30 and 40 combined with the first two bullet points. So really trying to do everything possible to make sure we are increasing statistical power and can be super confident that that this is a zero result. And yeah, my finding is that it's a zero result. So conclusion, this sort of anecdotal view that you always see, I would say always see on trade unions websites, for instance, that, oh, we have to grant people more vacation. Let's introduce, for instance, in Sweden, a 6th week of vacation or a 7th week of vacation for everyone, because that will benefit workers' health. Well, it might be wrong. That's what my paper really says. So if your aim is to improve employees' health, then maybe going directly for increasing vacation entitlement might just not be the best tool. Thank you.
Thomas, thank you very much. Very, very interesting. I see that we have a question from Benjamin. Do you want to unmute yourself?
Hi, Thomas. This is an excellent study. I'm curious. So there's a big gap between, at least in the US, between people who are allocated vacation time and the uptake of vacation time. So I think in your study, you're measuring allocated vacation time, right? So is there a similar gap in uptake? Because I would imagine that any sort of health results actually happen after people take vacation and not just being allocated vacation. Thanks again.
Excellent point, Benjamin. So it actually addresses two issues. One is the special case of the US, which is sort of the black sheep among all developed countries when it comes to paid vacation, because there's no national law on having even a minimum of number of vacation days. All other countries have that at least 2 weeks, actually, all other countries. So in the US setting, I would go for more studying the whole issue on the extensive margin, going from 0 vacation to having at least some vacation. But then, so my results are really on the intensive margin, right? Going from 28 to beyond. But then the other issue is sort of my analysis and intention to treat analysis. So I'm just looking at vacation days that are allocated, as you rightly say, to employees. So the question is, do they use the vacation? And there's no registry data to back up the fact whether people use it or not. I tried to find some survey data that looked into this issue, which said, yeah, Swedes use their vacation. I asked my Swedish family, because I'm not Swedish, but I asked my Swedish family, everyone employed at the university. I went to the trade unions and asked them for statistics, and everybody said, what the hell are you asking about? Why wouldn't you take your vacation? Everybody in Sweden takes their vacations. So sort of the anecdotal evidence that I have really points to the fact that there is a strong first stage. Everybody that gets vacation days uses the vacation days, because why not? Sort of, that's the attitude in Sweden.
Great. We have still a couple of minutes if anybody has any questions. In the meantime, I was just wondering, because the outcomes that you're considering are very specific, and I would imagine that for this type of marginal change in vacation time, that maybe some measures of, for example, mental health, like depression, things like that, would have a better chance of making an impact. But I don't know if you have access to some of those.
Absolutely. Excellent question also. So I looked at diagnosis. That's actually the first thing that I went for, because when I had the idea, I mean, it was born out of the sort of perception of, well, we need more time off in order to deal with depression and all these sorts of things, like poor mental health that we see in many countries in the Western world. And so I do this for all diagnosis codes, because I know why people went to the doctor or were admitted to the hospital or had to go on sick leave also, but none of the depression related things shows up. which is surprising. It's really surprising, but no.
Okay, very good. I think it is time to move on. Thank you very much, Thomas. Very interesting. And
thank you so much.
The next, thank you. The next paper and presenter is Benjamin Arts from University of Wisconsin at Oshkosh, and he's going to talk about does performance pay increase alcohol and drug use? Joint work with Colin Green and John Haywood. Thank you very much, Benjamin.
Thank you very much for having me, and I really appreciate getting published in the third issue here in 2021. It's an honor. I'm hoping everyone can see my screen and hear me. Please let me know if I can. Okay, great. So our purpose here is to further explore the performance pay literature and see if it's linked to increasing rates of use of alcohol and other substances like hard drugs and marijuana in the US. And so just briefly to go over the research questions and the results that we're going to cover today. First of all, does a possible association with or between being paid by your performance rather than just by how much time you spend at work, is that associated with higher rates of alcohol and drug use among people in the US because it might elicit more stressful work circumstances and people might turn to drugs and alcohol and marijuana as a sort of coping mechanism? And if that does exist, does it persist when we try to control for everything that we can control for in the data that we have? And then if it persists, is it a important size for us to care about? And just briefly, the results in a sample of young working Americans, so mostly in their 20s, indeed performance pay is linked to higher use of alcohol, marijuana, and hard drugs, and the results remain robust to all the different controls that we can throw at the model, and it is sizable. A roughly 1/3 larger group of performance pay workers will use substances than those who aren't paid by performance. So our motivation for this research really comes from the performance pay literature that mostly has emphasized increasing output, okay, through productivity enhancements and through attracting harder workers and maintaining maintaining those harder workers and preventing turnover. But there are also now documented costs of performance pay, as in the product quality is reduced because workers work extra fast and extra hard and maybe overlook some quality assurance programs. They're less likely to maintain the equipment that they need in order to produce the product. They might waste materials. They might not share information with colleagues so as to improve their own performance and get paid more. But one of the more prominent costs in our view was the idea that performance pay might reduce workers' health. This is under the idea that performance pay really rewards greater effort, harder work. And so workers want to exert more energy, take fewer breaks, and in fact, take greater risks, work too fast, and perhaps even get injured on the job as a result. But one sort of overlooked region of research in this realm is how performance pay might be linked to substance use if substance use is used as a coping mechanism for all of these added workplace stresses that people paid by performance have to endure. And this is overlooked essentially, especially in the economics literature. which is odd in our view because substance use costs are enormous. And in the US alone, you know, the social costs exceed $400 billion per year. So it seems like this is a worthy topic to explore. So our hypothesis is pretty simple, that being paid by performance increases how much stress you have to endure at work. And as a result, workers are more likely to use coping mechanisms like substance use in order to deal with that higher stress level. And so here's a funny sort of cartoon that says, I'm not really a social drinker. I'd say most of my drinking is work related, which may or may not be true for us all here. But so the data that we use to approach this is a panel study in the US called the National Longitudinal Survey of Youth. We're using the 1997 cohort. So that means that in 1997, they started interviewing these people, this cohort, between ages 16 and 21. We use waves 2002 to 2011. Those are collected every year between those 2 years. And we use those waves because they have consistent reporting of performance pay variables as well as substance use variables. Outside of those waves, we don't have the same types of reporting of those measures. So it is survey data, which means that the measures of alcohol and drug use that we have are self-reported. Marijuana and alcohol consumption is reported in the last 30 days. Our primary variable is just a dummy that reflects whether you did consume marijuana or alcohol in the last 30 days. And then hard drugs like cocaine and crack and heroin and so on, whether you consumed those in the last year. We do have count estimates of the frequency of use of these drugs and also how many of them you use. So whether you only use alcohol and not the other two, or whether you use 2 of them or all 3 of them, for instance. But in our sample, about 66% of people use alcohol. Nearly 17% have used marijuana in the last month, and then less than 5% have used hard drugs like cocaine. In terms of performance-related compensation, we don't have a ton of information about it. We do know whether people respond getting paid by tips, commissions, bonuses, incentive pay, and then in other sort of exhaustive category. We don't know, though, whether this is individual pay or if it's pay based on group work. And so because of all of that sort of uncertainty around the specifics of these performance pay items, we just group them together and note that about 21% of workers earn something, one of these types of performance-related compensations. We do later on in the study try to disentangle them and find that if we remove 1 or 2 from the grouping, it doesn't really change the results. So it doesn't seem as though our results are linked to one specific version of performance pay. The main concern that we have is sorting, because people tend to sort into specific jobs based on their ability or their risk preferences, and they also sort themselves into substance use based on these, according to the literature. So we wanted to control for fixed effects in order to try to tease out those sorting effects. Okay, so we first include proxies in cross-section analyses of ability using a kind of IQ test and risk preference that the NLSY gives us. But we also control for individual specific fixed effects. And we also employ worker in employer matched fixed effects to control for those instances where workers might switch jobs and performance pay at the same time. So when we control for worker and employer and fixed effects, what we're essentially doing is saying, okay, when a worker in the same employer goes from not earning a performance pay to suddenly now earning performance pay in their same job at the same employer. Does that have an influence on substance use? Okay, so here is our summary statistics table. I'm just going to skip past that because I cover the main ones already in the earlier slides. But here are the basically the outline of the variables that we have in our model. And here's our first table of results. We use logits to recognize the dummy variables of marijuana, hard drugs, and alcohol consumption. So in brackets and highlighted there, these are odds ratios. So essentially, the odds of consuming marijuana is 29% higher among people who get paid by performance than among those who don't. It's 35% higher for hard drugs and 45% higher for alcohol. But again, these are just pooled cross sections. So if we control for fixed effects.
Benjamin, you have about, well, you're already a little bit over time. So if I just want to let you know.
Okay, sorry about that. It goes fast. So after controlling for fixed effects, both individual workers and in employers, the results remains the same. Also among subsample estimates, we find that it's robust except for non-white men. This might be related to the stress that they already perceive in workplace discrimination. It could be some other things, but that's the subsample grouping that doesn't show the same results as all the other groups. And then this is just a list of all the other things we threw at the model to try to tease out the effect, but we can't manage to do it. The result is very robust to a number of different models and specifications. In conclusion, it seems that people who are paid by performance are much more likely to use substances like marijuana and hard drugs and alcohol. We can't tease out the effects. They're very robust. Essentially it's true for most people except for non-white men who don't seem to respond to performance pay in the way the other groups do. Okay, well, sorry for going over time.
It's okay. We have a few minutes for questions. If anybody would like to jump in. I do have a question. I was intrigued by the measure that you have of performance pay in the NLSY, and what I am wondering, because you use a very general definition of performance pay, and I wonder if you have played around with different definitions or aspects that you have available in the NLSY to get at performance pay, and how the results might vary with let's say a measure that is a little bit closer to what we have in mind when we think about performance pay.
Yeah, unfortunately, this cohort of the NLSY doesn't have a specific piece rate, which I think is what we typically think of in performance pay. So you're paid by the unit that you produce. We don't have that in this cohort. And sort of removing one or two from the grouping doesn't really change our results. So we don't see any lack of robustness if we play around with the grouping. It seems like there isn't one particular form of performance pay in the list that we have that is driving the results all by itself. What we may look at in the future is the sort of the proportion of pay that people earn from performance versus from just their salary or their time rate. So the NLSY can give us a sense of that. It's not the best, but perhaps other sources of data can give us a better sense of size of performance pay and whether that has an effect on either injuries or substance use or some other sort of health effect. Yeah.
Okay. Okay. And since there are no other questions, let me just ask one quickly. Have you looked at, let's say, within industry or within occupation comparisons?
We didn't. We only control for occupations and industries, but we didn't explore within industry or occupation effects. We were limited by sample size regarding that. We could just do a cross-section analysis there because of the sample size, but we couldn't do a fixed effects analysis for sure.
Yeah. Very interesting. Very interesting. Well, thank you very much. I think this is great, and I am happy to pass the torch to Madeline.
Great, thank you. So we have two more papers that are very interesting, so I encourage everyone to stick around for these cross-country papers. And so with no further ado, I'm going to hand it over to Jose Silva to tell us about maternity leave in 159 countries. So Jose, the floor is yours.
Thank you very much. Can you see my screen? Hello?
Yes, good.
Okay. Sorry. Okay. So, first of all, thank you for giving us the opportunity to present our paper in this really, really nice workshop. I'm really enjoying it. Just to motivate a bit the paper, it is well known that maternity leave can affect both labor supply and labor demand in different ways with a different uncertain theoretical effect in the labor force participation. And also, it is well known that job-protected maternity leave can also affect labor force through fertility decision. When we move to the empirical evidence, the empirical evidence tells us that there is some kind of non-monotonic relationship between maternity leave and labor force participation. And what is interesting when we look at the macro empirical evidence is that the paper has analyzed the effect on OECD economies. So what we do here is to extend the analysis of the effect of maternity leave in labor force participation through other countries, okay? In particular, 159 countries. Okay, so in order to account for the effect of maternity leave, direct or indirect, leave duration on female labor force participation, we think about a model. No, is in fact what we do. We extend a very well-known model by Bloom and others by introducing maternity leave. So we introduce maternity leave in a model of household that have to choose about the labor supply of women as well as the number of children. And then we test the prediction of this model using an unbalanced panel for the period 1994, 2004, 2011 for 159 countries. Okay. We also control for other variables like public sector size, legal origin, social norm, in order to reduce the impact of reverse causality. We do not address this issue directly here. And finally, talking about the social norm, we use a very relatively new survey conducted by Gallup and ILO about this general attitude to working women for more than 150 countries. And one of the questions is, they asked to the respondent is, it is perfectly acceptable for a woman in your family to have a paid job outside the home if she wants one, okay? So what are the results? We confirm the existence of what is called an inverted U-shape, okay? Or inverted U-shaped relationship between maternity leave duration and female labor force participation with a level of threshold of 30 weeks, okay? Below this threshold, to the left of this threshold, we observe that increasing maternity leave increases labor force participation, female labor force participation. Our theoretical model tells us that this happened because there is a reduction in the working time cost of employer model. So models have more available time, and this increases labor force participation. And this effect strongly dominates the negative wage penalty effect that comes from the firm, okay? Well, let me show you very briefly the model because we spent a lot of time in the model. Well, we have a household that consists of a man who supply inelastic 1 unit of labor, and we have women who have to decide about her time allocated between work, childcare, and leisure. Therefore, the utility of the representative household increases with consumption about the minimum level of substances. It also increases with leisure and with the number of children. And as a Bloom, we consider that there is a utility cost of achieving a lower level of fertility with respect to the maximum level, okay? They assume that this cause of fertility can be reduced with legal ground permitting abortion. Here we assume that also this positive attitude to a working woman can also reduce the cost, the utility cost of reducing fertility costs, sorry. Well, then we have the time restriction here. We normalize the time of the woman to 1, and then she has to allocate her available time to leisure, working time, childcare. So what we assume here with respect to the standard model is that maternity leave can also increase the working time of mother, available working time of mother, okay, as well as the social norm. The positive attitude to working women means, for example, a lower searching cost for women and therefore more available time, okay? This is what say is new with respect to the model of Bloom. Then we have the household consumption, where consumption is just the income of male plus the income of female, and here we have to take into account that if the leave is not paid, okay, at the rate 1 minus raw, there is a wage loss for women, okay. And finally, we close the model with the labor demand side, in which the marginal product of each worker has to be equal to the marginal cost. And importantly, we assumed here that there can be some collective administrative costs of potential productivity losses for the firm, which has a no combat cost, okay? Well, then we take the free order condition of the model, and here what we have is the ultimate level of labor supply. And what is interesting is that maternity leave, pay or unpaid, okay, I'm talking about both, can have an ambiguous effect on labor supply. It can increase the labor supply because from the worker side point of view, mothers have more working time, okay? But also it can reduce labor force because there is some wage loss during maternity leave, potentially some wage loss during maternity leave. And finally, there is a wage penalty effect from the firm side that has clearly a negative effect, okay? And with respect to the social norm, it has a positive effect. The more attitude to working women, the higher the labor supply. So then what we do, if we log linearize this labor supply equation, and then we have a third equation to estimate, which is the labor supply with exogenous fertility, okay, here. Then what we do is, okay, let's endogenize fertility. Fertility is also an important decision. And here, maternity leave can also affect labor supply through this channel. In particular, increasing maternity leave reduces fertility, okay? And also interestingly, increasing maternity leave also increases fertility because you have more time, sorry. And increasing fertility means reducing labor force participation. Well, and also importantly here, social norm has some clear effect on fertility. On one hand, it increases available time, therefore increases fertility, but also it reduces the cost of fertility, which means that you can have fewer kids. Then we log linearize also the fertility equation, okay? And then what we do is, okay, we substitute this fertility equation into our labor supply equation that I mentioned before. And then what we have is the total effect of maternity leave, including the endogenous fertility decisions here. And what is important is that it's so clear from a theoretical point of view, the effect of both maternity leave on labor force, as well as in the social norm. So what we do is, okay, let's test this model and see what happened. And I don't have time to explain all the model's variables, but what I have to say, which is important, is most of the variation here is across country, okay? More the standard deviation of the variable is across country, including the labor force participation, rather than within country, okay? So, and these are the main results I want to show you. In the first column, what we have is just the model, one regression, which is maternity leave, and this is square. Okay. In the second, we have the model. We include the other variables of the model, but assuming exogenous fertility. In the third column, we endogenize this fertility decision. Okay. And finally, in the last column, what we do is to control for other variables related, for example, with legal origin, religion, government consumption, in order to, let's say, minimize this potential reverse causality effect of labor force or maternity leave. So what we find here is, first of all, this inverted U-shaped relationship with a maximum of around 30 weeks of maternity leave. This is on pay or unpaid, okay? And interestingly, this threshold doesn't change if we activate or not the channel of fertility. Okay, this is the second important one. And finally, this positive attitude toward working women has clearly a positive effect on labor force participation. 10 percentage point increase in this positive attitude toward working women means an increase of 7 percentage point in labor force participation. So just to conclude, I want to show you this marginal effect, or marginal analysis of increasing maternity leave from 1 week to 60 weeks. Okay, and we can see that starting with a level of labor force participation of 45%, it increases until it reaches the maximum around 60 when we have 30 weeks, and then goes down and come to 45 again. So remember, what our models tell us is that here to the left, there is a strong working time effect that create this positive relationship. And here what we have is the wage penalty effect. And this is basically our main result in this paper. Thank you very much.
Fabulous. Thank you so much, Jose. If anyone has a question, raise your hand or put it in chat or just speak up. But I'm going to go ahead and ask one quick question. And then if there aren't others, we'll turn it over to Rita in order to get everyone, give everyone enough time. My quick question is, this is just maternity leave in terms of being able to take off work and have your job to return to, right? It's not necessarily paid, is it?
Exactly.
Okay. So
but we do control for the payment, for the proportion of the proportion of the wage that is paid. So we control for it.
Okay. Fabulous.
Okay. We control for if it's paid or not.
It doesn't matter.
It doesn't matter.
Really?
Really. Because, because we are talking about maternity leave, okay? I think when we extend the analysis to parental leave, okay, remember, maternity leave are just the first weeks of the parental leave relationship. But then if we talk about parental leave, other extensions, maybe I think I have no data from the ILO database, but I think here is more important. Pay leave become much more important.
Okay, interesting. Perhaps in the next paper. All right. So with that, I encourage all of you to look at the paper online and then contact Jose and his co-authors directly if you have comments or questions. And so with that, we will turn it over now to our final paper, which is another wonderful cross-country study by Rita Peto on gender differences in the skill content of jobs.
Oh, now can you hear me?
Yes, and we can see the screen.
And I'm trying, yeah. So now you can see and you can hear me as well, right?
Perfect.
Okay, so first of all, thank you very much for the opportunity to present here our research work, which is a joint work together with Balázs Reiser, and it's about the gender differences in skill content of jobs. About our motivation. So the gender gap in labor market outcomes has been decreasing dramatically since the Second World War, but it did not appear even today. But the gender convergence was driven mainly by decreasing segregation of women across occupations, across workplaces. But as Scott Clark and his co-author emphasized, the gender gap now is larger within occupation than between occupations. And as Black and his co-author pointed out, this within gender wage gap can be attributed to differences in actual skill use. And this is a very surprising pattern, since occupational categories are defined by a detailed list of tasks what workers should do at their job, at their workplace. And here comes our research question, is to understand why women use their cognitive skills less than men having the same occupation. And as far as we know, we are the first who look at the underlying mechanism behind this observed pattern. Just a quick overview of our results. So in the project, we used two survey data, the PIAC and the ISSP survey data, to estimate the gender gap in cognitive skill use and to understand the underlying mechanism. The PIAC data contains information, self-reported skill use indices, so contains information about what people are really doing at their workplaces. And what is unique in this data set is that it contains measures of the ability of the individuals by using test scores. We show in the paper that the conditional gender gap in skill use is large in economic sense as well, as it corresponds to about 4 years of schooling, so it's pretty large. And we also show that women living in a partnership use their cognitive skills less than men who live with a partner. And we argue in the paper that an equal division of housework is an important co-founder of our results. Just a roadmap for the presentation. So I'm going to first talk about the data and the empirical methodology that we use. And then I'm going to show you my main results. And then I will discuss it briefly, depending on how much time I have. So the data, as I mentioned, is a survey data. It's an international survey data. We have 12 countries in it. It's called the Program for the International Assessment of Adult Competencies. Just shortly, it's the PIAC data set. And what is, so it contains detailed information on the individual's labor market outcomes, educational outcomes, social background, family background, and it also contains information about their occupation. But what is more important for us is that it contains information about what people are really doing at their workplace. So it asks detailed categorical questions, such as how often do you use spreadsheets, how often do you fill in forms, and so on. These categorical questions, as summarized, are aggregated into skill use indices. In the main part of the paper and in the presentation today, we are focusing on the skill use measures that are related to the cognitive skills, so about numeracy, literacy, and ICT skills. But in the paper, we also show the results for the non-cognitive skill measures as well. And what is unique in this data set is that beside knowing what people are doing at their workplace, we also know their ability. And this is measured by cognitive test scores. We have access to the mathematics and literacy test scores. An additional data set that we use in the project is the International Social Survey Program, the Family and Changing Gender Roles part. And from this data set, we know how much time people spend on housework and family care. We create cells in this data set based on gender, marital status, one-digit occupational category, education level, and the number of children. We calculate the segment level averages of hours spent on housework and family care, and we merge it to the other data set. We ran a Mintzerian type regression to get the gender differences in skill intensity, and we pool all countries together. Our left-hand side variables are the skill intensity measures, so the numeracy, literacy, and ICT skill use at work. And our main right-hand side variable is the female dummy. So the focus of this project is the beta parameter, which shows the gender differences in skill intensity. We control for different set of control variables in the different settings. We know the family background, education, labor market, and firm characteristics. And as I mentioned, we are able to control for the ability of the workers. So we control for the test scores, and we are also able to control for the occupations. So we are controlling for 3-digit ISCO codes, but we're not just controlling for the 3-digit ISCO codes, which should be controlling for what people should do at their workplace. But we also control for the occupation country interactions to make sure that there might be differences in this by countries. And here you can see our main results. So the three different panels show you the results for the three different scale measures, while the three columns shows you the results using the different set of control variables. So the first column shows you the row results, so the row differences. And what you can see is that women use their cognitive skills about 0.3 standard deviation less than men. And even after controlling for country occupation fixed effect, this gender gap remained large and significant. It's about 2/3 of the row gap, which is very interesting since here we are already controlling for what people should do at their workplace. And as additional to that, in the third column, the control for the job characteristics that we have. And here we're already controlling for the ability of the workers. And what you can see is that the gender gap remained large and significant. It's about half of the row gap. And it's large in economic sense as well, as here I showed you the parameter, the estimated parameter on the years of education. So it corresponds to about 4 years of schooling, which is very large. And then the question comes is what might be the reason behind this? And what we find in the paper is that partnership matters. So in the next slide, I show you the results where we are including a partner dummy and we interacted with the female dummy. Here, I'm only showing you the results about the literacy skill used at work, but the rest can be found in the paper. What you can see is that now so again, the columns corresponds to the same control variables, so the same settings. The first column shows you the row gap, and what you can see is that the gender gap among single households is way smaller than what we found in the whole sample. And the positive and significant and very large effect of partner dummy, parameter on the partner dummy shows that men being in a relationship use their cognitive skills about 0.3 standard deviation more than single men's. And what is also important for us is that there is a negative and significant parameter on the interaction term. And this negative parameter of the interaction term means that the row gender gap among partnered individuals is with about 0.3 standard deviation larger than among single individuals. And if you add up these two parameters, then what you can see is that women having a partner use their numeracy skills with about 0.01 standard deviation more than single women. And this difference is not significant neither in economic nor in statistical terms. So what we can see is that having a relationship does affect the skill used at work, even though as we control for more variables, this effect is smaller, but it's qualitatively the same. But then the question is what might be the mechanism behind this? And what we argue in the paper is the time allocation of the individuals is an important co-founder of the results. So here we estimate the previous table, but now we are controlling for the hours worked on paid job. We directly observe this. And the segment level hours spent on housework and family care. What you can see is that people spending more time on housework using their skills less, while people spending more time on work use their skills more. And what you can see is that now the gender gap dropped among single household, but more importantly for us is that the interaction time dropped dramatically. It's about like half of, or even less than half of the size. In case of numeracy skill, it disappeared. It's not significant anymore. What we argue in the paper is that what might be the reason behind this is that individuals have capacity constraint on effort, so they should decide whether to putting more effort on work or doing more housework. And women end up doing more housework and using less skill at work. This might be a reason because of bargaining powers between the bargaining between partners within a household. It might be because of specialization within household, or it also might be because of social norms that force women to do more housework. We cannot differentiate between these channels, but either of these can be or are in line with our results. And I don't know how much time I do have, But in the paper, we rule out several other mechanisms that are not driving our results. So we show in the paper that we don't find any evidences for a pattern that partnered women may prefer to use less skills than single women, and they prefer to do more skills. So we don't find any evidences for this. Well, we also tested discrimination mechanism. We tested whether statistical discrimination based on skills could be a driving force, but we didn't find any evidence for that. And we also didn't find any evidence for discrimination based on birth rate in the paper. Yes, this is just a summary of what I said, is that we found that women use their cognitive skills less than men within the same occupation. And what we found is that the main driving force is partnership, and it works via time allocation. And thank you very much for your attention.
Absolutely fascinating. So I'm going to exercise my chair's prerogative to ask one quick question before I hand it over to Michaela to wrap up. And so Rita, as I reread your paper this morning, am I correct in understanding that it's really the housework that's driving it, not having kids or not?
Yes, we also
doing
showed that, yes.
Yes, this is, I think, table 16 in the paper. So doing housework makes women dumber.
Well, at least what we show in the paper, we really thought that it's about children. So we really did a very deep analysis about that. We really thought that it's about children.
Right.
But then we tried with focusing only on young women, like who were about to have children. Since we know the children's age, we were distinguishing between the age of the children, because that could also matter. Like having young children, you know, it takes more time from you than having older children, but none of this worked. So that's what I can say. So yes, it was a very big surprise for us as well, but it seems that it's really about cooking and cleaning up the house, even if there is no kids at all.
Yeah. Absolutely fascinating. And so terrific presentations from everyone. Thank you all so much. And with that, I will hand it over to Michaela to wrap up.
Thank you very much, colleagues. Thank you for all of our chairs of the various sessions for keeping us all on time and focused. And absolutely thank you to all of our presenters who gave a very insightful set of presentations on different country contexts and different methodological approaches. Thank you so much for your time this afternoon, or for some of you, again, mornings, evenings. Thanks as well to our attendees. I understand that for many of you, it's quite late. I'm looking at where our attendees come from. So thank you very much for dedicating so much of your time for us. I've posted in the chat box access to the journal issue and to the read links via the GLO website. So if you would like to access some of them, the contributions for free, if your own institution doesn't have access, you can do so via the read links. And just as a last announcement for all of us, the video from this event will be posted to the GLO website in the coming weeks. So if you're interested or would like to share it, feel free to do so. Thanks once again for all of your contributions. And I think actually we can now close the session. The only thing I would ask is if our presenters could please stick around for a few moments so we could take a group picture. In the meantime, I do see actually that there's a hand up from our audience. So I will flip very quickly over to our colleague, Peter Lang. Please, sir. I've given you the right to talk, so feel free to unmute. I'm sorry, colleague, we don't hear you. If you would like, please feel free to use the chat box.
Well, I'm sure what he is saying is that it's just been a fabulous set of presentations and papers, right?
I'm sure that's it, I'm sure.
And full of surprising results, I think, as well.
Counterintuitive, absolutely.
On the other hand, maybe Fox News.
You're based in Florida, no?
I learned a lot from all of the papers, but that one certainly confirmed some of my pre-existing biases, perhaps. Yes, so.
Okay, I think what can we do? I think Peter Lang is, I guess, just misunderstood what we were planning, or he wanted to be on the picture. Okay, no, I will talk with him. Yeah, Peter.
Oh, great, we hear you now.
Yeah. So people think you wanted to ask a question, but that's not what you want to do, I guess. You want to talk with me later, or what?
Yes, if possible. Let's talk later. Yes.
Okay. So I think we have, Michaela, we have the picture we could get. We have already, so we don't. We can just close down. Okay. So we thank you very much from my side. It was a nice session. Again, of course, there is this challenge to bring all this fantastic material in a few moments to an audience which you cannot really see is, I find, still a big challenge when I involve myself in presenting. So we all did a great job, and we have to see how we can continue with that. Thank you very much for participating, and yeah, see you soon, hopefully in person again. Bye-bye.
Thank you.
Thank you very much. Bye-bye.
And Peter Lang, we can stay both here, okay, for a moment.
Can you hear me?
I can hear you, yes.